Well, if you are looking for a top doctor, and who is it, you have come to the right place. Our next guest is cardiologist Dr. Tim Michael Dickfield. He is the interim clinical co-director of cardiovascular medicine at the University of Maryland Medical Center. Thanks so much for being with us.
Thanks so much for having me, Elsa. Really appreciate it.
Of course. So you are one of 12 cardiologists from the University of Maryland Medical Center who were named the top docs for 2020. First of all, congratulations to you and your colleagues. And secondly, selfishly for us, we want to know what that means for your patients.
Yep, absolutely. The top doctor designation is really recognizing the best of the best. The top doc listing give the patient insight, who are the most skilled, the most advanced, the most accomplished doctors really in the whole Baltimore metro region.
Yeah.
The designation is given after a lengthy 9-month peer review process. So actually a lot of other doctors, thousands of other doctors are being asked to provide whom they deem to be the leader in the field, whom they would send their patients to and their own family to. And typically about 6% of doctors are being recognized in that. Now, for us, 50%, really half of our full-time faculty this year is being recognized of being in the top doc tier. So this is really a big achievement accomplishments for us. And so if you're looking for the best of cardiac care, we at the University of Maryland want to be there with you and help you.
I think it's amazing that not only do you get this honor, which of course means a lot, but that it is from your peers. I think anytime you're getting an award from the actual industry and the people who are actually in the field and saying, hey, you are the best of the best, that means a lot. And it gives patients comfort knowing that they have these top docs right here in the area. So what kind of heart-related care is available to patients at the University of Maryland Medical Center?
We have experts in the general areas, people that come to us with high blood pressure, people that come with some narrowing of their coronary vessels and abnormal heart rhythm, abnormal heart valves. So we do have incredible breadth and collaboration among our division and our departments. But then, we also have those specialists which are frequently needed for complicated care. Those are all those really complex names, hard to pronounce, such as hypertrophic cardiomyopathy, and we really can deliver the most innovative, most accomplished care for those patients. We have leading cutting edge research, we have new devices, we have a lot of new technology that you can incorporate that and provide to our patients really what they deserve and need. So really changing the landscape with all of those components at the University of Maryland. For myself, I'm one of the heart rhythm doctors here at the university. And if someone needs a blood thinner but cannot take it or doesn't tolerate it, we have certain devices that people can receive and don't need to take those medications anymore. If you have complex abnormal heart rhythms, we have the ability of print your own heart in 3-dimensional printers, and we can use artificial intelligence to help us guide you on those procedures. So it's really an incredible time, an incredible environment to provide care to our patients.
I'm wondering for the patients, or maybe they're not even patients yet. I think a lot of times people put off heart-related problems, or they'll put off, like if they feel some sort of chest pains, they'll put that off because they're afraid that it could be a heart attack. Are you seeing that right now sort of exacerbated because of COVID-19, that people are also afraid of coming into the doctor on top of that?
It's really important for patients to know that if you have that feeling of chest pain, an elephant sitting on your chest, please do not delay the care. We have done a tremendous job in keeping our patients safe really from the moment they put foot on our campus to make sure they don't get infected. And that allows us to assess these patients and help them and provide the care that is needed and treat, and for example, a heart attack that otherwise could become a life-threatening condition. We have always the ability to see patients in person one-to-one, but what really have excelled at in the last years to bring telemedicine to the forefront at the University of Maryland. And so patients now have the ability to interact with their doctors in their own living rooms. And we have the ability of reviewing, for example, blood pressure measurements with them, review pill boxes with them, something we can send them actually monitors that are able to provide data with them. And so it really has been an eye-opening experience for us all that we can deliver really excellent care even from the home to the patients. And sometimes, having them have their family with them really has enabled us to, incorporate all the other family members. And that really has been an amazingly experience for all of our patients. I think we've been doing really good in keeping people out of the hospital due to that and providing good care to them. So that is certainly something that we are definitely happy to see everyone. Our normal contact number at the university is 410-328-7877. And then if you like, also go online under umm.edu/heart. That's where you can find all the up-to-date information, the ability to connect with us.
All right, Dr. Dickfield, thank you so much for being with us. And again, congratulations on being a top doc. And we'll be right back with more Midday Maryland right after this. Stay tuned.